There have been some pretty good data to suggest that a cholesterol level above 40 is consistent with exudate, and below 25 is very consistent with transudate. You kind of get in a gray area in between there. I think it can be useful in those situations where you're borderline, maybe one of life criteria is positive. So I think having that test, and if it's really high, then it can really point to you that, yeah, there's some inflammation going on, just because the pathophysiology of utilizing the cholesterol is thought to be related to degenerating cells and vascular leakage from increased permeability. And that is more consistent with kind of an exudative effusion. So, I think in those situations where maybe patients have been hospitalized for a little while, have gotten various medications, it's probably a useful tool to help you kind of differentiate transudate from exudate. The only other thing I'll say on cholesterol is sometimes it can falsely imitate a chylous pleural effusion in a exudative effusion that's kind of been sitting there for a long time. So I think if you get this milky fluid that comes back and you're concerned for a chylothorax, make sure you're also sending a cholesterol in that situation, because if the triglycerides aren't elevated, but if the triglycerides are not super elevated, but the cholesterol is, then that's going to be a pseudochylous effusion. So keep that, it's a pearl to keep in the back of your mind for when you see that and that situation comes up. But I think otherwise we've touched on the important stuff with cholesterol.
Awesome.